Hey there, everyone. Good evening and welcome to Revolutionary Health. Thank you for coming back and joining us. Revolutionary Health is a program of the Counter Narrative Project, and the mission of the Counter Narrative Project is to build power among Black gay men and to work in coalition and solidarity with all movements committed to racial and social justice. You can find us online at thecounternarrative.org. You should go ahead and follow us on social media. So we at Facebook, we are at the Counter Narrative Project. At Instagram, we are at The Counter Narrative, and at Twitter, we are at Building Desire. Since you are here with us on YouTube, and we are grateful for that, you should hit the thumbs up button and like this video, and make sure that if you haven't done so, that you go ahead and subscribe. So, I am Johnny Cornegay. I know, there's always so much to say. I am Johnny Cornegay, and I am Mobilization Director for the Counter Narrative Project, and I'm joined with...
My name is David Malbranch, and can I do Mariah Carey one more time?
You can. So
when our theme music was coming in, I was brought back to Mariah Carey's Honey video where she couldn't dance, but she was doing this. And it's just like honey. Whew, got that out of my system. I'm good. All right. My name is David Malbranch. I am the co-host with the wonderful Johnny Cornegay. I'm a physician, activist, and just an idiot. Obviously. I'm sorry.
Listen, oh my God, we just did the honey dance. So thank you all so much for joining us this evening. So there is a chat window. It is right there on your screen or on your phone. You can interact, and we really are going to need some. We got a lot to talk about tonight, y'all.
Yes, we do.
Oh my God, we've done a lot of revolutionary healths, and as we were preparing for this show, my mind has been blown already. So we're going to be talking about diabetes from a lot of different angles, but there'll be a lot of, David, you get to be very doctor-y tonight.
I know. Let me put on my Wait, do I have my stethoscope?
Do you have your stethoscope? If David is grabbing his stethoscope, and while he grabs his stethoscope,
Nope,
he doesn't have it. Darn. But please interact with us, ask questions, comment. We want to hear your stories. This is one of those things, and you know this, right, about me. So first of all, ZD Johnson, thank you. This needs to be a podcast. Thank you so much. This is one of those topics, personally. So within my family, and I'll just kind of leave it at that, I know that I have been learning a lot about diabetes.
Right.
And the darker, difficult side of diabetes. So I've been in this for the last couple of months, and this is kind of near and dear to my heart.
Yeah, I think it's near and dear to a lot of our hearts. And I mean, people talk about having a touch of sugar, a little bit of sugar. I got some sugar in my blood, all that kind of stuff. And we talk about diabetes, but we don't talk about like how common it is within Black communities and the impact it has on all of our organs, and that we're twice as likely as our non-Hispanic white counterparts to suffer complications from diabetes. And because of other things in society, like lack of insurance, lack of access to care, things like that, we tend to suffer a lot more complications because of diabetes. So it's an important thing to go over. And I do want people to understand as we go through this that we'll be talking a little bit about insulin, where blood sugar comes from, how insulin, the hormone, works, and then why it's so important for you to make sure you're on top of your blood sugar and what it is.
So. I have an interesting question. So as we lead into, diabetes is, of course, what I'm learning is there are people who specialize in like diabetes. Endocrinologists. Yeah. But, one of the things that we know is that because so many people suffer from it, is it important that primary care physicians kind of be up to speed?
Yeah, and I think that's a good point. So one of the things you need to know is that if you do have diabetes, the most common form is type 2, which is usually, it comes on in adulthood. And there's another type called type 1, which is more of kind of a genetic variant that runs in families predominantly. And it's basically your immune system attacking the organ called the pancreas, which secretes the hormone insulin, which keeps your blood sugar down. And so there are two types of it, but I think when we think about diabetes and kind of what happens with it, it really becomes problematic at a certain point, particularly with type 2, because it's the most common cause of kidney disease. It can be a risk for heart attacks and things like that.
Yeah. So I guess my first question to kind of ground us in this discussion, one of the things that we are going to talk about later on, I want to preview this and let the folks know who are watching, is that we are going to talk about the connection between diabetes and HIV.
Yes.
I think that's really important. So
We'll do that a little
stay
later.
tuned for that. We're going to definitely go there. And Dr. Q is with us, and Dr. Q said, as I sit here with a dozen Krispy Kreme.
Excellent. Dr. Q, you're thin as a rail. I don't think you have a thing to worry about. Go ahead and eat that Krispy Kreme.
Right. So I think my question is, what is diabetes?
So diabetes is kind of abnormally high levels of blood sugar or sugar in the blood. And I think if we do have a graphic,
Oh yeah, I think we got some graphics.
Alvin can show us the graphic that we talk about. So when you think about eating food and things like carbohydrates, carbohydrates actually get converted to sugar in the blood. And that's kind of what happens, or glucose as we call it. So it gets in the blood, it gets to your tissues. And the reason why it's so important is because you want your sugar to get to your muscles, your tissues, your cells, because it all gives it energy. But when the blood sugar gets too high in the blood, your pancreas actually secretes insulin. Insulin is a hormone that regulates your blood sugar and helps your cells and your muscles and your body parts actually take up the sugar a lot more. So if your insulin isn't working, the sugar, the glucose, can't go from your blood into your tissues so you have energy. And so that's problematic. So what happens at that point is that you have too much glucose in your sugar or in your blood, and then you end up having high blood sugar or what we call diabetes. So it's kind of an intricate relationship. Your liver is actually the organ. Your liver is right here. That's the one that produces a lot of the glucose. And your pancreas is on the left side. And so your pancreas kind of keeps it regulated, and if your pancreas is not working for whatever reason, that's what happens. And so when we think about, I'll talk about type 2 diabetes because that's the most common one. And it's commonly seen when we're adults because if we're eating a bad diet, lots of sugar, lots of carbohydrates, you end up having all this sugar in your blood. And then your insulin at certain points, it is always stimulated. So your pancreas is always secreting insulin to try to keep your blood sugar levels down. And at a certain point, your body's tissues don't react to insulin anymore. So it's a process that we call downregulation, but it ends up that your cells, your tissues don't respond to insulin, and therefore you can't get the sugar into your vital organs, your tissues, all that stuff, and it just stays in your blood, and that's when you have high blood sugar or diabetes.
So I think what's interesting even about that is, one, yes, Caleb, we too love an infographic. Thank you so much for joining us, Caleb. And two things before I make my comment. If folks are just joining us, please make sure you hit the thumbs up and make sure that you subscribe to our channel to stay in touch with us. And this isn't going to appear on the screen, but it's important. If you do want more information about diabetes, if you go to diabetes.org, you can find more information there.
That's the American Diabetes Association website, because ADA also stands for the American Disabilities Act.
Yes.
So it's a different ADA, but if you go to the website, it's www.diabetes.org. You can find a lot of helpful information about diabetes there.
Perfect. I'm going to talk about this the diet thing, and I know we're going to talk a bit about some of the things that we can eat, but so much of the stuff that we eat, because we eat so much processed food in this country, is full of sugar and white flours and all of that. And what I have found is trying to eliminate that from the diet really does take some effort.
It really does, because it's everywhere. And you think about fast food, you think about sweets, you think about complex carbohydrates, you think about things like spaghetti, rice. All these things are carbohydrates, and what they end up doing is that when they get into your bloodstream, they get turned into glucose or sugar, and then your body's just overloaded with sugar all the time. Your insulin is kicking into overdrive, trying to keep it down, trying to get your body to take up all that sugar, and then it ends up failing at a certain point, and that's what's problematic. And even, I think we have a graphic that Alvin has, as far as we look at fruits and stuff. So a lot of people will think, well, okay, if I'm doing this, I can just eat a whole bunch of fruit, and fruits aren't really that sweet all the time. And people actually don't think that fruit juices like cranberry juice, orange juice, that's all sugar.
It's all sugar.
That's all sugar. So if you look at this graphic with the best fruits for a diabetic diet, if you have diabetes or what we call pre-diabetes, which is kind of like your sugar's getting high, but not high enough to be diagnosed with diabetes yet, you can see the fruits at the top. It's something called the Glycemic Index or the GI. which basically talks about how much sugar is in these certain fruits. And you see at the top of that graph, you see the low glycemic index, or the fruits that really don't have a lot of sugar in them. You see like cherries, grapefruit is really good, dried apricots, which I thought nobody ate, but Johnny told me he actually eats them, pears and apples. And then if you look at that middle tier, you see oranges, I think those are plums, strawberries, and what are those, peaches and grapes? Those are ones that have a kind of mid-level of glycemic index, or they have a little bit higher sugar. And then the ones at the bottom of this graph are the ones that are the worst if you're diabetic, if you're trying to keep your blood sugar under control. So of course, watermelon, cantaloupe, and pineapple, which are all of our favorite fruits, are all the ones that are the worst for us as far as sugar is concerned. And so when you look at that and you think about what you need to eat, you really need to cut a lot of stuff out of your diet, which is a hard thing to do. What I will tell people is that when you go and see a doctor or a medical provider, there used to be old tests that we did to check out, diagnose you with diabetes. This is the simple thing, and they'd have you fast, and then they'd have you measure it like 2 or 3 times. It was really a pain in the ass. It's a lot simpler right now. The best screening test that we use is what's called an HbA1c. And it's called glycosylated hemoglobin. Basically, hemoglobin is that part of your red blood cell that takes oxygen to your tissues, but it also attracts sugar or has sugar on it. And what it does is it tells you, that number will tell you how high your sugar has been over the past 3 months or so.
Got it.
The normal value is less than 5.7. If you're anywhere, or below 5.7, if you're anywhere from 5.7 to 6.2, that's considered pre-diabetes, okay? If it's over 6.2, that's where they would diagnose you with diabetes. If you just look like at a fasting random blood sugar, like if you're fasting, you haven't eaten anything for 8 or 9 hours, and you do a little finger stick to check your blood sugar. If your blood sugar is less than 100, you're good. If it's between 100 and 126, that's pre-diabetes. And if it's over 126 when you're fasting, that's considered suggestive of diabetes. Wow. And so these numbers are kind of very important, and why it's important for you to look into it, like any other screening test, like an HIV test, like a mammogram, those kind of things. You probably should be getting these once you reach a certain age, probably like 35, 40, maybe like once a year to make sure you're okay. If you're overweight, you probably should be doing it. If you're living with HIV, you probably should be getting it checked once a year to make sure you're okay. Or if you have a family history, it's a good idea to get these things checked with your either yearly or every 6-month checkup.
Perfect. I'm actually going to bring in some comments. Walter, thank you so much for being with us. And he said, hey guys, I am 38 years old. I have end-stage renal failure and have been on dialysis for 10 years and living with HIV for 19 years. I'm not a diabetic. I have great doctors, but open to new ideas and tips. Thank you so much, Walter. And we're actually going to go into this next section and talk about the connection. But I want to bring in a couple more comments. David Morgan said, David, that breakdown was perfect. Now I get it. Morgan, I feel the exact same way. Thank you. And damn, I need to really watch my carb intake. There's a point I want to make really quick.
Yeah.
The fruits that were the bad ones, keep in mind when we go to buy fruit salads in the supermarket, it's full of watermelon, pineapple, and cantaloupe.
Those motherfucking fruit baskets, they all have the bad stuff for you.
Yep.
Those edible arrangements, they have those fruits, pineapple, strawberries, cantaloupe, and watermelon, all dipped in chocolate. So when you think about like diabetes in a box, you think about all these kind of different things that we see with people.
It's just amazing. And thank you, Walter, saying good to know. And Kevin, thanks a lot for joining us, Kevin. Hello all. Thank you all for talking about this. Kevin, we love you. Thank you so much. So let's talk a bit about, because this was mind-blowing to me as well, the connection between diabetes and HIV.
So there was a recent article that came across my emails, and I subscribed to a newsletter about HIV clinical trials, and they said that they just checked for prevalence, and prevalence just means at any one point in time, if you look at a certain population, how many of that population has a certain disease at that moment in time, not followed over a year or two, but just at that moment in time. And I believe it was a Danish study with men living with HIV, and they found that there was a 15% prevalence, which means if you had 100 people living with HIV, 15 of them would meet criteria for type 2 diabetes. They assumed that this was because possibly inflammation on the pancreas and the certain cells that produce insulin. Also, some of the antiretroviral medications could be causing this as well. And as people get older, we gain weight. And if there's weight gain associated with certain antiretroviral medications, that can cause it as well. So the one thing I do want to get across to brothers that are living with HIV is to get your HbA1c checked. And when you go for your general checkups, ask your provider to get that checked for you, because that's going to be an important thing to think about. Because at some point we always think with HIV, like, oh, my viral load's undetectable, I look good, everything's fine. That's the only thing I need to be concerned about. And that's not the case. The reality of the matter is that if you're living with HIV, your life expectancy is going to be just as good, if you're on medications, undetectable, just as good as someone who doesn't have HIV. So now you have to worry about the other shit that everybody else gets. So it's not, people always say, well, it's not the death sentence it once was, and it's not.
Right.
But the other part of that, the flip side of that, is that now all these other diseases that other people get, we have to worry about as well. So just make sure if you're living with HIV to get your HbA1c checked, or make sure you're finding out from your doctors or medical providers what tests they're actually doing. Are they checking your glucose? Are they checking your urine? Are they making sure it's okay? One thing I wanted to mention to people as well is that diabetes is important because it can affect your eyes, it can cause eye problems, it can affect your heart, and it definitely can affect your kidneys. And I know Walter had mentioned that diabetes didn't cause his kidney failure, but you do need to know that diabetes is the #1 cause of kidney failure in this country.
Wow.
And so it's the #1 cause of that. And so, again, when you look at the disparity among blacks and whites, you can see where these things kind of fall out. And people wonder why so many of us go into kidney failure, end up being on dialysis. Part of that tracks back to diabetes, high blood pressure, and the combination of those two eventually doing in our kidneys.
Wow. I want to bring in a comment, actually a couple comments from Kevin. Thank you so much. Kevin said, I can't recall the study, but I did research that minorities, especially those who identify within the LGBTQ plus community, are at greater risk for developing type 2 diabetes as well.
Yes.
Wow, thank you. And Kevin, if you have that study, we'll certainly, certainly put that in the comments because we want to make sure that we have access to that. Thank you. And a follow-up comment. Oh, thank you. I was diagnosed with type 2 diabetes back in August of 2018. I had the blood work done, and I found out that my A1C was at a high of 13.1 with a glucose of 301.
Yeah, so if you remember the numbers that I gave you before for your HbA1c, you want to make it below 5.7 or at least below 6, and that's your kind of target goal. So if it's at 13, that's like double what it should be. I hope your levels have gotten lower since there's medication. And one thing we will mention about this, when you do get diagnosed with diabetes, you should be following up with a doctor probably every 3 to 4 months once it gets under control. Usually we start with weight loss, exercise, diet, those kind of things. Then you can move to more of oral medication, so pills like metformin, glipizide, other ones like that, Januvia, are common ones that we see. And those medications tend to work either on the liver or on the pancreas to help your liver either secrete less glucose or to help your pancreas produce more insulin to keep that blood sugar down. And then if the oral medications don't work in combination or by themselves, at a certain point it gets to the point where you're injecting insulin, which is where you inject it just under your skin. They have other delivery systems where they have the nice little pens that don't really leave that much of a mark anymore. But it involves, like, it can be really a negative impact on someone's quality of life because you're constantly having to check your finger sticks. You see someone living with diabetes always has to check their sugar. They always have to make sure they're measuring out their insulin. So it's something, if you can avoid it early or get it checked out early, it's one of those diseases that's preventable, that if you avoid the typical American diet with processed foods and sugar and everything like that, you can really save yourself a lot of heartache later on.
Wow. So a couple of things. Thank you all for your comments. I'm about to bring in a couple more. But if you are just joining us, please make sure that you hit the subscribe button and make sure that you hit the thumbs up button and like this video. And please go ahead and share it out to your friends and family and let them know that we're here live for another few minutes talking about this really, really important topic. And thank you, David, for all of this information because, I mean, it's just, I want to talk about how it affects the limbs. We talked about that, but I want to bring in these comments and then we'll go there. Yeah. So this is a great question. Thank you so much for this, Morgan. Are there any natural remedies, herbs or teas that we can take to prevent inflammation of the pancreas? If you don't know any, we could certainly find something. But
I don't know any offhand, but I do know that a lot of times we think about things like green tea, other herbs. I don't know about like St. John's wort, milk thistle, those kind of things that people tend to go to a lot. I don't know if those have helped with reducing inflammation that may influence the pancreas or something else like that. Green tea is always a good one. And I just think it's one of those things where like we may look for like herbal remedies, but a lot of it is just about our day-to-day diet.
Right.
And if we're able to drink a lot of water and then avoid like the sodas, even the diet sodas, because the diet sodas make you eat more. So conversely, you don't actually lose weight because that sugar substitute in Coke Zero, Diet Pepsi, Diet Dr. Pepper ends up making your body crave for more sugar, and you inadvertently end up being more hungry, and then you eat more as a result of it.
Wow.
Cutting out the fruit juices, orange juice, cranberry juice, any of those juices are going to make your blood sugar skyrocket. But I think a natural diet, something that has like lettuce, natural herb or vegetables, greeny leafy vegetables are going to be good. And then also portion control. So lean meats like chicken, salmon is always good. Those fish and chicken and meats, turkeys, those kind of things that are lean meats aren't going to have a lot of those complex carbohydrates. They're not going to have a lot of the sugar that's going to raise your blood sugar up. So those are always good alternatives. But that's a great question. The short answer to your question is that I don't know a lot of herbal stuff, but hopefully we can get back maybe on the next show and follow up with that.
And what I think is beautiful, and thank you all so much, because y'all are sharing things with one another in the chat.
That's great.
And that's like what this show is about. So thank you all so much for sharing with one another. So I'm going to bring in a couple of those comments. Derek was saying, if it's okay with Dr. Bragg's raw apple cider, I actually drink Bragg's apple cider with just a little bit of honey on a semi-regular basis. It's a very refreshing. I kind of wake my body up with that. Kevin, thank you so much for giving us that update, because you mentioned 13.1 before, but you said you're down to 7.9 with your A1C.
That's
with a glucose of
phenomenal.
154.
Good for you.
Shout out to Kevin.
And also too, like that's a good point, because when someone gets diabetes, they used to say that they would try to get them below 6, but now they're saying that once you get below 7, that helps to reduce a lot of the complications that you'll see. So good for you, man. I know that's not an easy journey, so kudos to you for staying on that so strong.
Absolutely. And Walter said, thank you, David. High blood pressure and obesity crashed my kidneys. Diabetes has been something I've always looked out for in my condition, and this is helpful.
Yeah. So before we may get to more comments, and please keep your comments, your questions coming. We're gonna explain a little bit of something else. So we mentioned about the organs that you want to look out for, like your eyes, your heart, your kidneys. But what people don't also realize is that when you get sugar in your blood and your blood sugar stays that high and unchecked for that long of a period of time, it affects the big blood vessels in your body, but it also affects your smaller blood vessels. And it's the ones that go down to your hands, the ones that go down to your feet. Now you think about what blood does. Blood carries hemoglobin, red blood cells, and oxygen to your tissues. You need oxygen for your tissues to stay alive, right? And also, if you have a lot of high blood sugar, the blood vessels aren't going to be able to bring the blood and the oxygen as well as they usually do. High blood sugar also can damage some of your nerve tips in your feet and in your hands, and it's a condition called peripheral neuropathy. Why that's important, and the movie I always go back to when I think about this, is if you all saw Soul Food back in the day, the movie Soul Food, because remember Big Mama had diabetes, and I think they mentioned it explicitly, but Soul Food was all about, the Sunday dinners, having the big meals and everything, but it's also like a cautionary tale about what that diet does, because she was in the hospital all the time, and I think she had an amputation, if I remember correctly. But this is what happens. So when you have high blood sugar and it's affecting your blood vessels and the oxygen that goes down to your feet and also your nerves, at your feet, you may experience numbness and tingling, but you also can't sense things as well. So the common story is that someone with unchecked diabetes will step on a nail, step on a tack, or have a small cut on their foot. You don't notice it because how many times do any of us actually look on the bottom of our feet? We don't look at it that much. So what happens is that not only does that little insult that you have, that cut or that scar or that scrape, doesn't heal as well, you can't feel it, so you don't treat it appropriately. But also, all the sugar in your blood prevents your immune system from actually sending white blood cells to help it if it's infected. Now, what happens as a result of that is that a small infection can become a large infection. It starts to cover your foot, your tissues in your foot, and then starts to go up your leg. And then the tissue dies because it's not getting enough oxygen. There's all this blood sugar. Your immune system can't fight it. And so the tissue dies, and it's called gangrene. And that's when the tissue in your feet start to die, your toes start to become black or greenish color, they may smell funny, and that's when people need to amputate it, because if you leave that in there, the infection can get in your blood, your tissues, your bone, and then when it gets in the bone, it's either 6 weeks of antibiotic treatment and or IV antibiotic treatment and or you have an amputation. So I've seen people get toes cut off, half of their foot cut off, their feet, or what they call an above the knee amputation, where they cut off your leg above your knee, or below the knee amputation. So the short of it is that when you have diabetes and you're going to see your providers, especially a primary care provider, they need to be checking, you need to have your eyes checked at least every 1 to 2 years. You need to make sure your heart is okay. You need to check your blood for your kidneys, make sure those are okay. Check your urine to make sure your urine isn't spilling a lot of sugar. Then also make sure your doctor does a look at your feet. And it's important to check it. They use either a feather or this little, like a small little device called a monofilament, and it checks to see if your sensation to light touch is intact. Because if you can't feel stuff on the tip of your toes, you're gonna be at risk of that. So they'll tell a lot of people who are living with diabetes, don't walk around barefoot a lot. Be careful of what's on the floor, make sure everything's clean, because if you cut yourself, you may not feel it, and that's where things can get into trouble. So if you are living with diabetes or have relatives with diabetes, check their feet.
Absolutely. And I think, thank you so much for that. To just make sure that if you are a person who's living with diabetes, just one, pay special attention to like these key areas. If there are things that I think if folks are feeling like, or just make sure that you're checking in with your doctor,
Right.
Because it is so incredibly important. And personally, what I can say is I have seen some of these things kind of show up in kind of my personal experience with family, and it's tough.
It's really
It
tough.
is tough, and so thank you, Doc, for
And sometimes
sharing
it's not
this.
even, I was going to say with the feet, sometimes it's not even a cut, but it's like a callus or like a thickening underneath the sole of the foot. And so when it gets thick and hard, you can't feel anything either. And so when you cut yourself or you nick yourself, or some people will like take what is it called, a pumice stone, and they'll try to like shave down, or you go to get a pedicure and they cut into your toes or they cut into the cuticle or they're clipping something and a small little insult happens. That's where problems start to happen. So you really have to be careful with that.
Thank you so much for that. So I do want to bring in a couple more comments, and I'm going to do some final thoughts in a moment. But I'm going to go back to Kevin, who said, hey, Kevin, he said, I spent 3 days in the ICU, and from there I had no choice but to take insulin. And he also noted that turmeric is said to be helpful. Thank you so much.
Yes, I have heard that as well. Thank you.
Thank you so much for that, Kevin. I'm going to go down to ZD. He said, I drank bitter melon tea and water. And also noted that when I was diagnosed in December of 2017, I ended up with a 513 blood sugar and almost in a coma. I'm off all insulin.
Yes.
Wow. My A1C was 6.7 during his last appointment. Also, congratulations, ZD, for that.
Yeah, and that's an important thing to note. I will tell people this, that I've seen patients who have, and also friends and family members, who have started on oral medication. So when you get diagnosed with diabetes, don't think it's the end of the world that you're automatically going to have to inject yourself with insulin or you'll be on medications for the rest of your life. Work with whoever your provider is. And even if your provider isn't that aggressive, be aggressive yourself. Like literally start to do a lot of research. Start to drink a lot of water. Take all the juice and the soda out of your refrigerator. Do those kind of things, because I've seen people just reverse their lab work to normal blood sugars. I've seen people go on oral medications and then get off them. And I've seen people have diabetes so bad that they've been in a coma, been in the ICU. It's called diabetic ketoacidosis, or DKA. If you go into the hospital for that and you're on insulin when you leave, once you change your diet, your exercise, you're drinking a lot of water, all of a sudden you don't need the insulin anymore because the insulin is really a strong medication. Sometimes it can bottom your sugar too much.
Got it.
And that's when people get sweaty, they almost pass out, and then you have to give them orange juice or a candy bar or something like that to kind of get their sugar back up because you literally overshoot it.
Wow.
And what I would tell people is that your blood sugar being too low is much more acutely dangerous than your blood sugar being high. Your blood sugar can be between 200 and go up to 300, 400. And you may have some symptoms, but there's not an acute risk of dying. If your blood sugar gets below like 40, 30, like literally you can go into seizures, you can go into a coma, you can die. So if you're on insulin, if you're on any medication for diabetes, and you're starting to notice that you feel lightheaded or dizzy or a little bit off sometimes with your medications, it may be a time to check your medications, revisit it with your physician, a nurse practitioner, or PA, and say, hey, do we need to adjust some of these medications if you notice your sugar starts to trend low? But I've seen people go from insulin to oral medications. I've seen people go from oral medications to nothing. I've seen people go from high blood sugar and just to normal blood sugar when they institute like a really strict regimen of diet, exercise, drinking water, all those kind of things.
Wonderful.
So it is possible. It's not like you have to be stuck with this for the rest of your life. There are things you can do.
Yeah. Wonderful. I want to thank everyone who joined us today and were active in the comments. And so if you haven't done so, please make sure that you hit subscribe and make sure that you hit the thumbs up button. And also make sure that you leave a comment and share this video and let folks know that you are watching this particular show and share it widely. I think this information is just so, I can't stress how important it is for Black folks to have this conversation in this way.
Yeah, it really is. And it's something that's not, if you start to think about your liver producing blood sugar, your pancreas producing a hormone to lower your blood sugar, and kind of how that interacts, and the fact that if you're eating too much sugar or too much carbohydrates, your blood sugar is going to go through the roof, and it's going to overwhelm your natural body's defenses or way your body actually maintains it. It's a lot easier to understand. It can be daunting, but again, I would go to that website, diabetes.org, to check out the American Diabetes Association, because they really break down things in a nice, simple manner. So if you're afraid of any kind of medical terminology that it's going to be too complex, they really break it down for you so it'll be easy to understand. But it is an important thing that we need to know about, so stay vigilant.
Please. So make sure that on social media you are following us. We are on Facebook at Counter Narrative Project. On Instagram, we are at The Counter Narrative. And on Twitter, we are at Building Desire. You can visit us online at thecounternarrative.org, and you can make sure that you join our mailing list and stay in touch with the Counter Narrative Project and all the exciting things that we have coming up. So thank you for joining us. We're here on the Orange Couch, hashtag the Orange Couch. See, it's orange, and we are here.
And we on it.
We on it, so make sure that you share that information. And thank you for joining us for this particular show. Like I said, such an important topic, and I'm grateful for you. Go ahead, Doc.
No, I was going to say shout out to Lex Smith. Lex with Signature Affairs is a catering company. He wasn't able to make it today, but we're going to have him on at some point. Also, shout out to Jason Henry and Turks and Caicos. Thank you, Jason, for hosting me this past weekend. And also, shout out to Terrell, the YouTube celebrity that Jason introduced me to while I was in Turks and Caicos. And while I should have been outside enjoying the sun, I'm sitting inside watching Terrell and his YouTube channel.
Right.
And just enjoying the hell out of his energy and how he brings the singers on and all this other stuff. So if y'all want to entertain a YouTube channel, of course, after you check out ours and you're doing the Counter Narrative and Revolutionary Health, go check out Terrell. It's Terrell. It's a hysterical YouTube channel. But shout out to you, Terrell. You're doing good work.
Awesome. And I want to, as we kind of wind down, Kevin T, who's been like in the comments. Kevin wasn't able to join us live for this particular show, but Kevin, I'm so grateful that you were able to join us in the comments and be willing to share your story.
Kevin Tarver.
You know, Kevin Tarver has been, thank you so much, brother, for all that you do and being willing to share your story with us. So we will be back next week. So we have a super special show. Father's Day is coming up. And we are going to be talking about Black gay fatherhood.
Yes.
So we're going to be talking to Black gay dads and just kind of celebrating, fathers and getting ready for Father's Day. So join us back here on the Orange Couch next week, and we're going to have this interesting and fun conversation where we get to love on our dads and love on Black gay dads.
Absolutely.
And the work that goes into fatherhood, man. This is going to be a great show. Back here next Wednesday for Revolutionary Health. Thank you so much for joining us this evening. Have a great, great evening. Bye.